Good evening, everyone. It is my privilege to introduce a leader in Caribbean mental health care, Dr. Rishi Ramoutar. A specialist psychiatrist with over 15 years of experience, Dr. Ramoutar has built a distinguished career rooted in both clinical excellence and academic rigor. His advanced training spans some of the most respected institutions in the world: Harvard University, Johns Hopkins University, and the University of the West Indies. Today, he serves as Medical Director of Wellness Caribbean Mental Health Specialists, one of the region's premier providers of comprehensive mental health services. In this role, he leads a multidisciplinary team delivering expert, evidence based care with compassion and integrity. But Dr. Ramtar's impact goes far beyond the clinic. He is a relentless advocate for public education and a fearless voice against the stigma that still clouds conversations around mental illness. His mission is clear: to promote awareness, encourage early intervention, and create a culture in which mental health is prioritized, not hidden. Tonight, we are fortunate to hear from someone whose work stands at the intersection of science, service, and social change. Please join me in welcoming Dr. Rishi Ramoutar.
Hi, good evening, everyone. I'm so glad you could join us for this seminar this evening on ADHD. ADHD is one of those things that touches many lives, but too often it's still shrouded in mystery, confusion, and misunderstanding. You see, I've had patients come to me in their 30s, 40s, and even their 60s saying, Doctor, I just thought I was always lazy or forgetful, and now I'm understanding there might be a reason for it. I've had parents sat in my office in tears, knowing that their child is very bright and full of ideas, but in school they're being told that they're disruptive, they're not reaching their full potential, and parents are worried. ADHD is real, it's not new, and it's not just a childhood condition. It can affect us at every stage in our lives. But here's the good news: once we understand it, we can manage it. And people with ADHD, when they're supported, can often bring incredible energy, creativity, and problem solving skills to the table. So let's dive in. So, tonight I'm going to take you through what ADHD is and what it isn't, the common symptoms of ADHD, the different types of ADHD. We're going to talk about the risk factors and the causes. We're also going to talk about how ADHD is diagnosed and what happens in the brain of those who have ADHD, why the ADHD behaviors make sense when you understand the brain's wiring. We're also going to talk about management options, including what's available here in Trinidad. And we're going to do some practical coping strategies, which you can start today. So, what is ADHD? Well, ADHD is a neurodevelopmental condition, meaning that it starts in childhood and it's connected to the way the brain develops and the way the brain functions. It is not a phase that your child will grow out of. It's caused by a difference in the brain structure and function. It is not caused by laziness or indiscipline or lack of willpower. And the main features are inattention, which is difficulty in sustaining focus, being easily distracted; impulsivity, which is acting before thinking things through; and hyperactivity, which is physical restlessness or mental overactivity. Imagine the brain as a busy airport. And in most brains, the control tower communicates clearly with the pilots. So they know which flights need to land, which flights will take off, and in what order. In ADHD, the control tower is still there, but the radar sometimes glitches and the radio control isn't always clear. The planes, in this case, which are the ADHD person's thoughts, impulses, and tasks, are still coming and going, but not always in the right sequence. And sometimes those planes they just circle the runway instead of landing. So let's talk about some of the symptoms of ADHD. We're going to start with the hyperactivity and impulsivity symptoms. One of the common ones is fidgeting. So, for example, in a meeting, you're always tapping your pen, twiddling your thumbs, you're sitting and having to swivel in your seat or shaking your legs. These are symptoms of fidgeting. You could also find it difficult to sit in your seat for a long time. So, in church during the sermon, you might find that you need to get up and stretch your legs often. Or children sitting in class need to get up and move around. You might also feel a sense of restlessness. So, you can't really sit and be still or be calm. An inability to relax quietly. So that need to be doing something constantly. Even if you're by the beach on a Sunday, you can't just sit and relax. You need to be doing something, like being on your phone or having a conversation. It's hard to just relax quietly. People with ADHD might also feel like they are driven by a motor, jumping from errand to errand without a pause. And children are super hyperactive in that they are just going and going and going, like a little Tasmanian devil around the house. One of the other common symptoms is talking excessively. So, dominating the conversation in a gathering, or the child constantly getting in trouble in school for talking too much during class. They might also have difficulty in blurting out answers. So, the teacher hasn't finished the question and they blurt the answers out. Or you might find yourself interrupting people when they're speaking to you and finishing their sentences. They can't be answering fast enough. You have to interrupt them. You think they're not getting to the point quickly enough. You might also have difficulty in waiting your turn. So you can see this in children where they are very impatient with waiting their turn. So even in adults, right? Like you are standing in line to get doubles and you're so impatient because you find everybody is taking long, or you're waiting in line at Marcy to cash and you find that you have no patience in waiting. These are some of the symptoms of hyperactivity and impulsivity that can indicate ADHD. The other category of symptoms, which are the inattentive type symptoms, these include things like making very careless mistakes. We see this commonly in academic and work environments. So children know their work, but they end up losing marks because they misread the question or they completely skip over the question or just make one very small error that completely changes the outcome. Difficulty sustaining attention is another main one. So you might start doing a task, but then you drift off to check something halfway through. You might also fail to follow through on tasks. So you start washing the dishes, you get a phone call that interrupts you, you answer the phone call, and then you forget to go back and finish washing the dishes. People with inattentive symptoms might also appear to not listen when spoken to directly. I hear this very commonly in parents who say they're talking to their kids and the kid is there, but doesn't the message doesn't seem to register, or they are very forgetful. So you tell them to go to the fridge and bring an apple, and they go to the fridge and they forgot what they went for. These are some of the inattentive type symptoms in ADHD. Disorganization is another major symptom. So when kids have to get things in order to do homework, they can't seem to get things and settle down. Or if you have a task to do, like going to renew your passport, you need to get multiple different things done. Go get your passport photo, make the appointment, fill out the forms. It seems like these tasks take a lot of effort when they should be very simple. Sometimes when tasks take a lot of effort, procrastination sets in because you know that it's going to be unsuccessful, it's going to take a lot of sustained mental energy on your part. You procrastinate. Children put off doing homework or keep saying, next time I'll do it, or in 1 hour I'll do it, and sometimes never get around to it. Another one of the main symptoms is being easily distracted. So, distracted by noise in the environment, or if you're in the office and somebody walks by, you can't just tune that out and continue your work. You must give it some attention. And one of the other symptoms is losing the necessary items. So, things like your keys, your wallet, your glasses, always misplacing them. These are all some of the symptoms that can occur in ADHD. Now, there are three types of ADHD. One is the predominantly inattentive type, where the inattentive symptoms are more prominent. That's problems with focus and organization and so on. There is the predominantly hyperactive impulsive type, where there is more restlessness and more hyperactivity and impulsivity. And then there's the combined type, where you have a mixture of both types of symptoms. Let's talk a bit now about the causes and risk factors associated with ADHD. Now, ADHD doesn't have a single cause. It's a result of a combination of genetic, biological, and environmental factors that influence brain development. There are genetic factors, which we know of. There is a strong hereditary link that links ADHD and families. So ADHD does tend to run in families a lot. Studies show that if a parent has ADHD, their child has a much higher chance of developing it. There are also differences in brain structure and function, particularly in different brain areas and different chemicals in the brain, which we will touch on in a bit. There are also environmental and prenatal factors. These are things like prenatal exposure to things like nicotine, alcohol, or illicit drug use during pregnancy can lead to a child developing ADHD. A mother being very stressed out in pregnancy can also lead to increased incidence of ADHD in the child. Children who are born premature or who are born small or low birth weight have an increased risk of developing ADHD as well. And we know that childhood exposure to toxins, so things like lead that used to be in the pipes, or lead from paint, or contaminated soil, all of those things can contribute to ADHD. We also know that early childhood influences can contribute to ADHD symptoms. So things like severe neglect early in childhood or trauma, these can affect brain development and emotional regulation and can worsen ADHD symptoms. Let's talk a bit about the brain behind ADHD. When we talk about ADHD, it's tempting to focus only on the behavior. But to truly understand it, we need to look at the brain's structure and the brain's chemical systems. So there's an area in the brain called the prefrontal cortex, and this is like the CEO of the brain, right? This is in charge of planning, in charge of organization, making decisions, and self control. And what we have seen in studies that have been done, it shows that this area, the prefrontal cortex, is smaller and less active in people who have ADHD. That means that the part of the brain that controls these things is not as effective. Therefore, it explains why these people might have difficulty with planning, organization, decision making, and controlling their impulses. There's another area of the brain called the basal ganglia. And this is sort of the hub in the brain where we regulate movement and attention. And disruptions in the basal ganglia explain why some people with ADHD are constantly feeling like they're pulled towards constant motion or they struggle to maintain focus on repetitive tasks. The third area is the cerebellum, and traditionally this is linked to controlling your movements, but it's also important for timing and coordination of your thought. It's assumed that in this area of the brain, if there are difficulties, it can lead to time blindness that many persons with ADHD tend to complain of, where they just don't know how much time has passed, and it leads to constantly being late, and can affect someone's functioning significantly. Apart from the structural differences, there are also differences in the chemicals. The different chemicals in the brain, we call them neurotransmitters. Those are the ones that control how the brain communicates with itself, basically. One of the main ones is called dopamine. And dopamine is important in what we call the brain's reward system. It tells you that this task is important, so keep doing it, keep engaged. And in ADHD, the dopamine levels are reduced so that the tasks that are not immediately stimulating, they feel extraordinarily boring. And it feels like to sustain energy and attention on these boring tasks feels like you're pushing a car uphill. It's really hard if you don't have that dopamine. Another chemical is noradrenaline or norepinephrine. This is the one that supports alertness and concentration. And if this noradrenaline is underactive, then sustaining alertness and attention becomes difficult, especially for tasks that are boring and repetitive. A little bit and talk about how do we diagnose ADHD. So diagnosing ADHD involves a comprehensive evaluation rather than a single test. There are a few different methods that are used, and it's different for different people. So for children, depending on their ages, and for adults, there are different tools that can be used. So usually it begins with what we call a clinical interview, where a psychiatrist will speak in depth with the patient or with a parent if the patient is a child. And we talk about things like their developmental history, so from childhood to present, their academic and work performance, any medical and psychiatric history, any family history of ADHD or other mental conditions. And we also explore how these symptoms are impacting your daily life. There's also behavioral observation, and we look for things like distractibility or restlessness, impulsivity, or difficulty completing your tasks. These are an indication objectively of some of the symptoms of ADHD. There are also some questionnaires that might be useful. So we use different ones like the Connors rating scale, the Vanderbilt ADHD rating scale. And these help us to quantify the symptoms and compare what might be normal behavior versus inappropriate or abnormal behavior. We also rely a lot on what we call collateral information. So that's gathering reports from teachers, from family members, or colleagues who might interact with this person in their daily life. And the purpose of this is to get confirmation that the symptoms are occurring across multiple settings. We also do medical examination where appropriate. So, physical examination might be necessary to rule out other causes like a thyroid problem. We also review any medications that might contribute to ADHD symptoms or worsen them. So, what happens if ADHD is left untreated? Well, it's not harmless. It can really impact and shape a person's whole life. One of the main impacts is on their academic performance. So, very bright students might underperform because they miss instructions, they forget homework, they can't pay attention in class, or they procrastinate so much that they're forced to cram last minute for exams. And over time, this leads to a drop in their performance, so they might not want to pursue education altogether, leading to dropping out of school. There are high levels of ADHD in persons who've dropped out of school. There are also workplace challenges that happen with untreated ADHD. So, chronic lateness, disorganization, missed deadlines, and difficulty in prioritizing tasks. This can all lead to people having a stall in their career and leading to frequent job changes. Some people job hop, not because they lack commitment to their job, but because they're searching for environments that are more stimulating and they get bored very quickly with the work that they might do. Untreated ADHD can also have significant impacts on relationships. People with ADHD, their partners often report that they may feel ignored or feel unimportant because the person who has ADHD is forgetful or easily distracted, and you're not giving the attention to your partner like is required to maintain a healthy relationship. Another common complaint we hear is that there are lots of arguments in relationships due to things like incomplete chores, impulsive spending, and interrupted conversations that people with ADHD can display. There are also lots of emotional regulation problems with ADHD, and this is one that a lot of people are not really aware of. ADHD brains can swing quickly from being calm to being very frustrated, from being excited to being very deflated and depressed. It's also important to remember that navigating life as somebody who has ADHD can be very difficult. Imagine being constantly criticized for things that you can't control. So you're taught that you're being a troublemaker in school, or you're not paying attention, or you're too talkative, or you're careless. These are seen as very negative criticisms of you as a person. And no matter how hard you try, you might continue to fail in your academic or work life. And this can build shame and build low self esteem. And then these can lead to secondary mental health issues because we know that people who have untreated ADHD have much higher rates of depression, anxiety, burnout, and substance use disorders, often from years of struggling with ADHD without any kind of support. We also know that physical health and safety is also a problem in those who have ADHD. Research shows that people who have ADHD have higher rates of accidents, speeding tickets, or injuries due to making impulsive decisions. They may also neglect medical appointments or treatments due to forgetfulness. The good news is that ADHD is treatable and people can really flourish with the right support. So let's talk about some of the management options. Of course, one of the most effective ways to manage ADHD is with medication. And although medication isn't right for everyone, it can be really helpful for some people. There are two main classes of medication that we use, and these are stimulant medications. The ones that we have in Trinidad are Concerta or methylphenidate. And these work by increasing the dopamine and noradrenaline in the brain. Remember, we spoke about those being the chemicals that are deficient in ADHD. So these medications increase those chemicals and therefore make it easier to focus and control impulses. And it works quite effectively for people who struggle with focus and controlling their impulses and hyperactivity. There are also non stimulant medications like atomoxetine, for one example. And these are useful for people who don't tolerate stimulants well and they work more gradually, but over time they could be effective. However, we don't usually have them readily available in a steady supply here in Trinidad. Another way of managing ADHD is with therapy or coaching. So, therapy, particularly cognitive behavioral therapy or CBT, can help persons develop organization systems, their problem solving skills, and emotional regulation tools to help them navigate having ADHD. And ADHD coaching can be helpful for some people as well, where you focus on building daily habits and on accountability with your coach. Lifestyle adjustments are also really important, and we'll go into some more details with those in the next section. Education and family involvement. This is very, very important. And this is the main reason why we've decided to have this free seminar here tonight. When families and partners and teachers understand ADHD, they can shift from frustration to being supportive. And we also know that accommodations are usually necessary for many people who have ADHD. When someone is diagnosed with ADHD, depending on their specific needs, requests can be made from the psychiatrist to make accommodations for this person. The most useful way is in school settings, where children who have ADHD might need extra time in exams or different exam setting or venue or certain other accommodations in terms of coursework and the way schoolwork is delivered to them that might be helpful in giving them a better chance at succeeding. At our practice at Wellness Caribbean Mental Health Specialists, we combine all of these elements into personalized treatment plans. We support children, teens, and adults who have ADHD. Now, I want to leave you with some coping strategies that can be helpful that you can start from today if you or your child has ADHD. Now, these are not replacements for treatment, but they make a big difference in daily life. I'm just going to touch on some of them, but for a much more practical and expansive masterclass in how to manage ADHD and some life hacks to use, we will be presenting these in an upcoming webinar in about 2 weeks' time. The details will be coming up on your screen at the end of the presentation. So if you're interested in those, feel free to sign up for that. But just as an overview, we can talk about some ways to help yourself with organization and planning. So things like visual planners, color-coded calendars, or phone apps can help people manage their time. Also, setting timers for work intervals. For example, setting a timer for 25 minutes of work and then a 5-minute break. This can be helpful in keeping track of your tasks. Breaking up large projects into smaller, more defined steps can also be helpful. Environmental design is also really important. So setting up your environment in such a way that it limits the amount of distractions that you can have, closing your browser tabs that you're not using, or silencing notifications on your phone. This can help reduce distractions and help improve your focus and performance. Accountability is also really important. So, sharing your goals with a friend or family member or colleague who can check in with you to make sure you're keeping on track with things that you need to get done. ADHD is not a flaw, it's a difference in wiring. And with the right combination of understanding, treatment, coping strategies, all of these differences can become strengths. So, if you've heard yourself or your child or your partner in tonight's examples that we've given, consider getting assessed. The earlier you start understanding your brain or their brain, the sooner you can make changes that will transform their life. Thank you, Babe, for being part of this conversation tonight. I look forward to seeing you all at our next webinar, which is going to be on a masterclass in practical steps and hacks to deal with life with ADHD. If you have any questions, feel free to ask. Remember that I cannot give you specific medical information, but I can give you general information to be able to help you. Any questions?